Come closer, because what I'm about to share is not something most people over 50 ever hear in a doctor's office. After 50, drinking plain water may not be improving your circulation the way you think it is. In fact, depending on how you drink it, it may be doing almost nothing for blood flow at all. I know that sounds wrong. We spend our entire lives being told that water is the answer to everything. Drink more, stay hydrated, problem solved. But the science tells a very different story for aging bodies. Once you pass 50, your blood behaves differently. The signals that tell your blood vessels to relax and open up begin to fade. Blood thickness increases slightly. The fluid balance inside your circulatory system shifts in ways that a glass of plain water simply cannot correct. That is why so many people drink faithfully all day and still wake up with cold hands and feet. Still feel that heavy dragging in their legs by afternoon, still crash after lunch, still push through a fog that never fully lifts. The water is going in, the circulation response is not following. In this video, I will share 5 simple hydration strategies shown to improve blood flow in adults over 50, ranked from least to most powerful. Some cost nothing, all can start today. My name is Dr. Gregory Allen. I have spent over a decade working with older adults on circulatory health. Everything I'm about to share is what I now recommend to patients before we ever discuss medication. Stay for all 5. The number one strategy is the one almost nobody does correctly, and it takes under 60 seconds. Before we get to the 5 strategies, I need you to understand what is actually happening inside your body after 50, because once you see it clearly, everything that follows will make complete sense. Your blood is not simply liquid. It is a living suspension of cells, proteins, minerals, and hormones moving through a network of vessels whose inner walls are biologically active. Those walls, called the endothelium, do something remarkable. They produce a molecule called nitric oxide, and that molecule is the signal that tells your blood vessels to relax, open wider, and let blood flow through freely. When nitric oxide production is strong, vessels dilate easily, blood moves efficiently, and oxygen reaches your muscles, your organs, and your brain without resistance. After 50, 3 things change at the same time. The first change is nitric oxide production drops. The enzyme responsible for making it becomes less active with age. Vessels stop dilating as readily. Blood pressure tends to climb because the walls simply cannot release their tension the way they once could. The second change is blood viscosity increases. Your red blood cells lose some of their flexibility as you age, which means your blood becomes slightly thicker. Thicker blood demands more effort from the heart to push through the smallest vessels, especially in the hands, the feet, and the brain. That is where you feel it first. The third change is plasma volume decreases. You have less fluid circulating through the system overall. On top of that, the kidneys become less efficient at holding on to water, and the thirst signal, the internal alarm that tells you to drink, becomes blunted. Many people over 50 are living in a state of mild chronic dehydration without ever feeling thirsty. Now here's the critical part. Plain water addresses only that third problem. It adds fluid volume, but it does nothing to restore nitric oxide production. It does nothing meaningful for blood thickness. And when you drink large amounts without replenishing the right minerals, it can actually dilute the electrolytes your vascular muscles depend on to contract and relax properly. The result is what I call being hydrated by volume, but not by function. The water is present, the circulatory response is absent. That distinction is everything, and it is exactly what this video is designed to fix. Let me tell you about a patient I will call Henrietta. Henrietta was 71 years old, a retired school teacher, and one of the most disciplined people I have ever worked with. She drank 8 full glasses of plain water every single day without exception. She tracked it in a small notebook she carried everywhere. She came to me because of symptoms her regular doctor had not been able to explain for almost 2 years. Her hands and feet were permanently cold, even sitting indoors on warm days. She experienced afternoon fatigue so severe that lying down after lunch had become a daily routine, and she described a mental cloudiness that made concentrating feel like pushing through wet concrete. Her blood pressure was normal. Her standard lab work showed nothing unusual. Every doctor she had seen told her she was in good health. When I reviewed her hydration habits carefully, the problem became clear within minutes. She was hydrated by volume, but her vascular system was not receiving the signals it needed to function properly. The water was there, the circulation was not responding. We will come back to Henrietta after strategy number 1. What happened to her in the 6 weeks that followed is something I want you to experience for yourself. This is the entry point. It costs nothing, requires no preparation, and is more physiologically significant than most people ever realize. The temperature of the water you drink and the timing of when you drink it relative to movement both directly affect how quickly water enters your bloodstream and how effectively it expands plasma volume. Here is what the research shows. Room temperature water, somewhere around 68 to 72 degrees Fahrenheit, is absorbed significantly faster than cold water straight from the refrigerator. Cold water triggers a mild constriction response in the blood vessels of the gastrointestinal tract. That slows absorption and temporarily reduces blood flow to the peripheral vessels, meaning your hands, feet, and lower legs. For someone already dealing with sluggish circulation, that temporary constriction works directly against you. The timing piece matters just as much as the temperature. Drinking water in the 15 minutes before any physical activity, even a short walk around the block, maximizes the plasma volume expansion effect. When plasma volume is higher before movement begins, the heart pumps more efficiently, vessels dilate more readily, and blood flow to the extremities improves in a measurable way. Studies on pre-activity hydration in older adults consistently show that drinking room temperature water 15 minutes before movement produces better peripheral circulation outcomes than drinking the same amount immediately before or during activity. The practical change is straightforward. Stop drinking cold refrigerated water throughout the day, switch to room temperature, and make a habit of drinking 1 glass approximately 15 minutes before any planned movement, even something as simple as walking to the mailbox. This single adjustment costs nothing, takes no preparation, and begins changing the functional hydration equation in your body immediately. This is where the real mechanism shift begins. When you drink large amounts of plain water without replacing the minerals your body loses, something counterproductive happens. The concentration of key electrolytes in your blood plasma drops. Specifically, sodium, potassium, and magnesium levels decrease, and those 3 minerals are not optional extras. They are the electrical signals that govern how your vascular smooth muscle contracts and relaxes. Potassium and magnesium are natural vasodilators. They activate the same biological pathways that prescription calcium channel blockers target, except they do it through mechanisms your body already understands and knows how to regulate. When plain water dilutes these minerals without replacement, vascular tone increases. Your vessels stay slightly contracted instead of opening fully. The endothelium becomes less responsive to the flow signals telling it to dilate. This is the reason some people feel no improvement or even feel worse after significantly increasing their daily water intake. The volume went up, the mineral balance went down, and the circulation response suffered for it. The fix is simple. Add a small pinch of high-quality sea salt to every liter of water you drink, not table salt, which has been processed down to sodium chloride and little else. Sea salt retains trace amounts of over 80 minerals, including potassium, magnesium, calcium, and zinc, alongside the sodium. The amount needed is small, well below the threshold where you would taste it, but physiologically meaningful. If salt is not your preference, add a thin slice of fresh lemon to your water instead. Lemon contributes potassium and produces a mild alkalizing effect that supports endothelial function. A small splash of pure coconut water works as well, adding natural potassium without any processing. Research published in the Journal of Applied Physiology found that electrolyte-enhanced water produced significantly better improvements in vascular conductance in older adults compared to plain water over a 2-week period. The vessels responded more readily. Peripheral circulation improved. The difference was not in how much water people drank. It was entirely in what that water contained. Most people have heard of hibiscus tea. Very few know what it actually does inside the body. And almost nobody knows that the way you prepare and consume it makes an enormous difference in how fast it works. Hibiscus flowers contain 2 categories of active compounds that matter for circulation. The first is anthocyanins. the pigments responsible for that deep red color. The second is organic acids, particularly one called hibiscus acid. Together, these compounds do something that plain water cannot do. They directly stimulate nitric oxide production in the cells lining your blood vessel walls. Remember the first change we discussed? The one where nitric oxide production drops after 50 and vessels lose their ability to dilate properly. Hibiscus water addresses that change directly. It activates the same mechanism that many prescription vasodilators attempt to replicate through pharmaceutical means. A randomized controlled trial published in the Journal of Nutrition found that 3 cups of hibiscus daily reduced systolic blood pressure by an average of 7 points in prehypertensive adults over an 8-week period. The confirmed mechanism was endothelial nitric oxide stimulation. Here's how to prepare it for maximum circulatory benefit. Steep 4 to 5 dried hibiscus flowers in 500 milliliters of boiling water for 10 minutes. Allow it to cool completely to room temperature. Add a small pinch of sea salt and half a teaspoon of raw honey if desired. Drink 1 to 2 glasses per day at room temperature, not hot and not iced. The depth of color tells you the potency. A rich, deep burgundy means high anthocyanin concentration. A pale pink means the active compounds are weak. Always aim for the darker brew. Of all 5 strategies on this list, the timing of this one is what makes it so powerful. The first 60 to 90 minutes after waking are the most cardiovascularly vulnerable period of the entire day. Cortisol surges immediately upon waking. Blood viscosity is at its highest point after 7 or 8 hours without any fluid. Platelet aggregability, which is the tendency of blood cells to clump together, peaks in the morning hours. That combination creates the highest cardiac risk window in any given 24-hour cycle. The majority of circulatory events in older adults, including strokes, heart attacks, and clotting episodes, cluster between 6 and 10 in the morning for precisely these reasons. Warm water consumed within 10 minutes of waking begins reversing that vulnerability immediately. It starts thinning the blood and restoring plasma volume before cortisol reaches its peak. Adding fresh lemon juice introduces vitamin C, which is a direct cofactor in nitric oxide synthesis, meaning your body needs it to produce the molecule that opens blood vessels. Lemon also contains citric acid, which supports red blood cell health and improves how efficiently your body absorbs iron. Fresh ginger adds gingerols and shogols, compounds with documented antiplatelet activity. Research published in Thrombosis Research found that ginger significantly reduced platelet clumping in healthy adults, with the effect occurring within 90 minutes of consumption. Some studies have compared this activity to low-dose aspirin without the gastrointestinal side effects. The protocol is specific. Within 10 minutes of waking, before coffee and before food, drink 250 milliliters of warm water with the juice of half a fresh lemon and half a teaspoon of freshly grated or powdered ginger. Drink it slowly over 5 minutes. This is the most powerful strategy on the list. It is also the least known, and it targets the root cause of poor circulation after 50 more directly than anything else on this list. Dietary nitrates found in certain foods are converted inside the body into nitric oxide through a 2-step process involving naturally occurring bacteria in the mouth and acid in the stomach. Beetroot is one of the most concentrated dietary sources of these nitrates available, but the key insight from recent research is that this conversion is dramatically amplified when combined with a specific breathing pattern. Slow nasal breathing activates the paranasal sinuses, which independently produce their own nitric oxide and contribute directly to circulatory regulation. When the dietary nitrate pathway and the sinus nitric oxide pathway are activated simultaneously, the combined vascular effect is substantially greater than either one alone. A study published in Hypertension found that dietary nitrate supplementation via beetroot reduced blood pressure and improved peripheral blood flow within 2.5 hours in older adults. Separate research documented that slow nasal breathing increases sinus nitric oxide output by up to 15 times compared to mouth breathing. Here is the exact protocol. Stir 1 teaspoon of pure beetroot powder and a small pinch of sea salt into a glass of room temperature water. Drink it slowly over 5 minutes. Immediately after finishing, perform 5 cycles of slow nasal breathing. Inhale through the nose for 4 counts, hold for 2 counts, Exhale through the nose for 6 counts. The optimal timing is 30 minutes before physical activity or during the mid-afternoon window when energy and circulation naturally dip. The combined effect on peripheral blood flow is measurable within 30 minutes. Now I promised I would come back to Henrietta. 6 weeks after I introduced her to strategies 4 and 5, mineral-enhanced water every day and the morning warm lemon ginger protocol, she came in for a follow-up appointment. She had also added hibiscus water 3 days a week, more out of curiosity than any real commitment to it. She had not changed her medications, had not changed her diet, had not started a new exercise routine. The cold hands and feet that had troubled her for nearly 2 years were gone, not improved, gone. Her afternoon fatigue had dropped so significantly that the daily rest after lunch had simply stopped happening on its own. She told me she had read for 4 consecutive hours, 3 days in a row, something she had not been able to do in years. She looked at me and said, "I drank water every single day for 2 years, and nothing changed. You changed 3 things about how I drank it, and my whole body shifted in 6 weeks. Why did nobody explain this to me before?" That question stays with me. The research exists. The information is published. But a 15-minute clinical appointment is not designed to explain the difference between volumetric hydration and functional vascular hydration to an older adult. That is exactly what this video is for. Word count, 151. Before we wrap up, I want to address the questions I hear most often from people after they learn about these strategies. 2 categories come up every single time: medication interactions and specific dosing details. Let me go through the most important ones directly. I am taking blood pressure medication. Is this safe for me? Hibiscus water and beetroot both have mild blood pressure lowering effects. If you are already on prescribed antihypertensive medication, that combination deserves attention. Start with smaller amounts than recommended. Monitor your blood pressure readings for the first week and have a conversation with your prescribing doctor before increasing the dose of either one. The strategies involving temperature, timing, and mineral enhancement carry no such concern and are safe to begin immediately. I have kidney disease. Can I add salt to my water? No. If you are managing kidney disease or following any fluid or electrolyte restriction prescribed by a physician, skip the sea salt addition entirely. The remaining strategies, room temperature water, correct timing, hibiscus, lemon ginger in the morning, and the beetroot breathing protocol, do not involve added sodium and remain appropriate. But always confirm with your doctor first when a specific condition is being managed. I take a blood thinner. Is ginger a problem? Ginger has mild antiplatelet properties, meaning it can have a slight effect on how your blood clots. If you are taking warfarin or any prescribed anticoagulant, inform your doctor before adding fresh ginger to your daily routine. A half teaspoon of powdered ginger per day is generally considered a culinary amount rather than a therapeutic dose. But your prescribing physician knows your specific situation and their guidance takes priority. I have heart failure and my doctor limits how much fluid I can drink. What do I do? Respect your prescribed fluid restriction absolutely. Within whatever daily fluid allowance your doctor has set, you can still optimize the quality of what you drink using strategies 2 and 4. The goal is not to drink more, it is to make every glass count more. Never increase your total fluid intake beyond what your physician has approved. How much is a pinch of sea salt exactly? A pinch is roughly 1/4 to 1/3 of a gram, the amount that sits comfortably between the tips of 3 fingers. You should not be able to taste it in your water. If you can taste salt, you have added too much. What kind of beetroot powder should I buy? Look for a product labeled 100% pure beetroot powder with no added sugar, flavoring, or filler ingredients. The ingredient list should contain 1 item. Avoid pre-workout blends that include beetroot as one component among many, as the nitrate concentration in those products is unpredictable. Where do I find dried hibiscus flowers, and how do I know I have the right ones? Natural food stores and online retailers carry dried hibiscus flowers widely. Look for whole dried petals, not pre-sweetened hibiscus tea bags. The color should be a deep burgundy red. If the petals look pale or brownish, the anthocyanin content has degraded and the circulatory benefit will be minimal. What temperature is warm water for the morning protocol? Warm means comfortable on the back of your hand. not hot enough to sting, and not cool enough to feel refreshing. Roughly 104 to 113 degrees Fahrenheit. You do not need a thermometer. If it feels genuinely warm and soothing to hold, the temperature is right. Do I need to do all 5 strategies, or will 1 or 2 be enough? Start with 1. The strategy that feels most manageable for your current routine is the right one to begin with. 1 change applied consistently every day will outperform 5 changes attempted for 3 days and abandoned. Add a second strategy after 1 to 2 weeks when the first feels automatic. Build gradually. The cumulative effect of 2 or 3 strategies maintained consistently is substantial. Let me bring all 5 together one final time. Strategy 5. Room temperature water drunk 15 minutes before any movement. Strategy 4. Mineral-enhanced water with a pinch of sea salt or a slice of lemon daily. Strategy 3. Hibiscus-infused water cooled to room temperature, 1 to 2 glasses per day. Strategy 2. Warm water with fresh lemon and ginger within 10 minutes of waking, before anything else. And Strategy 1. Beetroot water combined with slow nasal breathing, 30 minutes before activity or during the mid-afternoon dip. The problem was never how much water you were drinking. It was what your water was signaling your body to do. If the only thing you do after watching this video is switch from cold to room temperature water and add 1 small pinch of sea salt, you have already changed the functional equation inside your circulatory system. Which of these 5 will you try first? Tell me in the comments right now. I read every single one. And if you know someone who drinks water faithfully all day and still deals with cold hands, heavy legs, fatigue, or brain fog, share this with them. The answer may be simpler than either of you ever expected. Subscribe for more honest, research-grounded conversations about what your body genuinely needs after 50. The information that rarely makes it into a 15-minute appointment, but that changes everything when it reaches the right person. Take care of your circulation. It is carrying life to every cell in your body, every second of every day. Give it the right signals. It will respond. Disclaimer. Everything shared in this video is general educational information based on published research in hydration science, vascular physiology, and exercise medicine. It is not a substitute for personal medical advice. If you are currently managing hypertension, kidney disease, heart failure, or any condition requiring fluid or electrolyte management, please speak with your physician before making changes to your hydration habits.